Well, greetings again. This is Dr. Bill Wyatt, and I am with the American Orthodontic Society, and I want to talk to you some about the main cause of TMJ pain and the insights and the solutions to some of them. I won't take that long to do it, but I'm going to try to cover some of the very important points in understanding the TMJ problem, and it should go along with dentistry. It's just a part of the jaw back in here, how it works and everything else. So let's get going here, and I'll try to show that to you as we go along. I'm going to touch this screen, and we'll hit this. What to do? There's a button. All right. Now this. All right. Now I'm going to stop this. Now, if you can visualize this in your brain, in your mind, this is the condyle right here, and I can't draw on it, but this deal right here is the condyle of the jaw. And when you open your mouth, the condyle moves from up in the upper part right here. Just watch it. It moves, and it goes in front of the eminence over here and comes out so far, and then it goes back. And this is biconcave. I'm going to stop that. That's a biconcave disc, and it kind of helps hold that in place. And I've been using mine for 96 years, and it's still working. And so it is unreal how the body is made, and that this portion in the joint is fed by synovial fluid from the upper part of the jaw and down from the lower part of the jaw, and keeps this center part of the disc alive. This takes so much force. There's no blood vessels or no arteries and nerves in this portion of this disc. And if you push it up there and tie it down and don't let it move, this disc, the center will die. And then you won't feel it because there's no nerves in it. And that is the big problem. Now, if you get hit in the mouth, I don't care what you play, what you're doing, if you're active, jumping and going around, you should wear a mouth guard. Something that you could close your teeth together and have maybe a couple of millimeters of space in there, cushion material that will allow you to close your jaws together. And now your jaw you get hit on the jaw, and you got it tied with the rest of the bone. It doesn't have a problem. But if you're going around with your mouth open more or less, or without any mouth place, and you get hit in the jaw down here, this portion of your jawbone will go right up against the skull, and also this is your retrodiscal tissue that feeds and also lubricates this joint. And this lubrication coming out of here is so slick. We haven't been able to make anything like it. And it also carries food particles to the bones, or to the tissue here that make up the center part of this disc. Now let this thing go for a minute, and we'll see. Now watch it open, and you see how the disc works. Now this is a healthy joint. I should have practiced more. Normal. Okay, we're back in business. Maybe we can cut that out of this. And this is the way this works. Your jaw goes out here, and that does that, and this is a healthy jaw joint. You've got to remember these guys in Sweden cut down cadavers that had just died, and they shaved this part off out here, and you're looking at it without the tissue around the other side. Now, if I want this to stop going, okay, I can press the little button. Now that stops. Now, if you get hit in the mouth and you've got a mouth guard in there, you have something between your teeth, and the jaw won't give. It puts that force up through your head and everything else. If you don't have something, your jaw is just holding on to your skull by tissue and ligaments, holding it up there, the muscles, the skin, and stuff like that. The jaw is just completely loose up here, but it works marvelously well, and people can go through life for 100 years, and it does good. And so I hope that if you do anything, or you know anybody, your children, your grandchildren, anything that are doing things that may get hit in the jaw, teach them to wear a mouth guard. Now, the mouth guard does several things. You can't bring your jaw out here and put the condyle out there, something like that. You can't hold it there unless you got something between your teeth. So when you get hit on the jaw, it's gonna drive it back like that. And it'll take it and shove it back into this tissue. Now, if you hit that tissue and you swell it up and it gets inflamed, if you get in some accident, get some ice pack on it, something to hold it to keep it from swelling. If it swells up and this gets thicker and bigger, then every time you chew, your condyle is going to press in there and make it hurt. And so people that have this problem, they will hurt this, and it's something that they constantly hurt because we're chewing all the time. We bite together and swallow, I think, a couple thousand times a day. I'm not sure, I didn't count them, but that brings this in, and it causes a pain up here, and the rest of the muscles of the head and the neck and everything kind of join in to help this. And so you end up with pain in the headache, the necks, and the shoulders hurt. Now this same pain, same kind of pain, can be brought about by somebody who gets their vocal cords all inflamed, and then they just keep using them. They'll get that same headaches, shoulders, neck, and for a long time doctors would look and try to find out what was wrong. They didn't put their fingers on the temporomandibular joint, or they could have found out, you know. But they examined, I had one lady, they examined her several times and they couldn't find anything wrong. And they said, well, in a sense, you're crazy, you know. So they were going to send her to an asylum for that. This is a smart lady, had her television program going. And she just happened to come by the office. And if you get anybody with that type of pain, put your hands up here, right in front of your ear, and wiggle your jaw from side to side. And if there's any pain in there, that's the culprit. It's working. So that's how you tell Just work your jaw like that, and you can put your finger right on this condyle down here as it moves around. And if it's sore in any way, that's where your problem is. So I hope this helps people understand. Now, I think anybody doing dentistry should know about the temporomandibular joint. I don't care whether I know a lot of orthodontists and also general dentists that say, well, that doesn't hurt. They don't know about it much. Check everybody you work on. How much did the jaw open? Does it go to one side? In other words, this be hung up in that way? Or is it functioning correct? Check people before you work on them. Because a lot of times you go in there, somebody's got a problem, and you work on them a little bit, and it makes them start clicking, and then they blame you for what was wrong when they came in. So check everybody you work on, jot it down. It's no big deal, just what we did and how wide you could open it. Did the jaw jump from one side to the other? Did it have a click in it? And was it popped back and forth in here? Check this out before you work on anybody. So thanks for watching, and I'm going to hang up and hope that you join our group, and maybe I can remember how to do some of this stuff sometime. Thank you for tuning in. But you'll learn something about the joint. I don't care if you're a dentist or not. It helps you as an individual. So I'm going to sign up and say thank you, and I'm going to close.